Susanti, boleh dikecilin suaranya? Oke. Thank you Mbak Susanti. Halo, selamat pagi Bapak Ibu sekalian. Terima kasih sudah hadir di webinar ServiceNow hari ini dengan tema Vaksin Administration Management atau VAM. Perkenalkan, nama saya Kevin Teja dari PT Mitra Integrasi Informatika sebagai Product Marketing Representatif untuk ServiceNow. Webinar hari ini akan membahas kapabilitas dari ServiceNow yaitu Vaksin Administration Management. Nah, yang seperti kita ketahui saat ini kan di Indonesia sendiri sedang dalam masa vaksinasi untuk COVID-19 ya, Bapak Ibu sekalian. Nah, sedikit gambaran solusi dari ServiceNow yaitu Vaksin Administration Management ini tujuannya itu untuk dapat membantu perusahaan Bapak Ibu sekalian untuk seperti membuat janji temu atau dokumentasi, inventaris dan lainnya. Nanti ada live demo juga supaya membantu memberikan gambaran mengenai solusi Vaksin Administration Management hari ini. Nah, di akhir sesi juga ada Q&A dan feedback form. Bagi yang mengisi feedback form juga akan mendapatkan Certificate of Attendee. Di sini saya sudah bersama Pak Olivier sebagai presenter, yaitu sebagai Customer Workflow Solution Consultant dari ServiceNow sebagai presenter hari ini. Nah, jika Bapak Ibu ada pertanyaan di tengah presentasi, bisa menulis di kolom chat atau bisa langsung open mic ya. Boleh juga menggunakan bahasa Indonesia, nanti akan saya bantu translate. Jadi harapannya agar webinar hari ini bisa lebih interaktif aja. Nah, saya langsung persilakan untuk Pak Olivier. Hello Olivier.
Hi, can you hear me?
Yeah. Sounds good.
Okay, hello. Selamat pagi Pak dan Ibu. Hari ini saya akan memperkenalkan Vaksin Management Solution ServiceNow. And that's as far as my bahasa go. So just a quick introduction. Yeah, thank you. So as part of that today, I'm going to talk a little bit about what is the Vaccine Administration Management Solution proposed by ServiceNow. And of course, we'll do several breaks during this webinar where you will be able to ask questions. And again, we can also ask questions in Bahasa, no problem. We have the local team here as well to be able. So let's try to make it as interactive as possible. And I will just quickly go through a safe harbor that you should not do any decision on buying based on forward-looking statement, but really on what we're going to show. So before I start, I just want to have a quick video giving you a quick overview about what our vaccine solution is going to be.
So much has changed. It's forced us to rethink many things. Access to care, how we return to the workplace, and the people and systems that make it all possible. Converting vaccines into vaccinations is one of the greatest workflow challenges of our lifetime. Globally, governments, healthcare organizations, pharmaceutical companies, and others need help. Successful vaccine management from distribution to administration and monitoring are essential for the health and safety of everyone. With ServiceNow Vaccine Administration Management, recipients can get self-service access to the answers they need, complete pre-visit questionnaires, view available locations, and schedule appointments. Provider admins can bulk schedule appointments and send reminders, and clinicians can easily verify recipient information, mark no-shows, and record vaccinations. And when we are ready, we can make going back to the workplace work for everyone. Whatever your business is facing, let's workflow it.
So converting vaccine into vaccination is probably the greatest workflow challenge of our lifetime. And quickly developing effective vaccine was the world's first challenge. But now we must rise to the second one, which is how do we get people vaccinated quickly by solving the various issues and problems associated with how to distribute, administer, and monitor vaccines. And this is how we are going to be focusing on today. So as part of a vaccine management typical flow, there are 6 critical areas in regards to vaccine management. And countries, hospitals, pharmaceutical companies are already supporting all this entire vaccine management workflow today. But we never had a system that needed to support the vaccination of every single individual, not just once, but sometimes as well twice within 3 weeks or 4 weeks, while you have to manage limited supplies, having rolling schedule, how to prioritize different groups of individuals based on age, on risk, on localization. And it's really in the view of this challenge that ServiceNow has launched a vaccine management solution that would support customers, patients, employee to really help to manage this process faster and in a seamless manner. So as part of today's presentation, we are going to be focusing on 2 points. The first one is really about patient or citizen or employee engagement. So there's really making sure, and this is really to be covering the entire process on when are we getting our vaccination, where do we need to go, which are the centers, clinics, hospital, and how is the administration going to be done. And the second point is going to be around the vaccine administration itself, from the moment the different vaccine arrives in batches, and therefore there is a need on how you prioritize and administer this phasing based on group of citizens or patients. And those are really the 2 areas that I will be covering today. So a lot of organizations are trapped in what we would call the last mile. So every country, state, local government, or even private companies are in the need to help to get vaccinated their people. So the current process is disconnected, unable to scale, lacks transparency to identify what are the current issues. And those are very complex workflows that are fluid, untested for this kind of scale. So most of the companies and organization and government are really focusing on the last mile. But today, what we're going to see is how can we actually go beyond that last mile and not only focusing on distribution, administration, and monitoring, but also providing edge challenges in terms of how can we help general inquiries management? How do we reach out to the different population, helping them to provide a self-service portal with deflection, where they will be able to find information about the vaccine, what is the process, what is the eligibility, where are the centers, how is the entire process going to work? Because after people get vaccinated, you also need to think about how can we transition them to be returning to work in a safely manner. But sometimes you also need to have third-party integration with immunization systems or EMR systems as well. So we're not going to be focusing the last mile, but really this entire topic here about really going beyond the last mile. So as part of today's webinar, we will be focusing on 3 key aspects. The first one is really going to be about the persona himself who will get vaccination, whether they are patient or employee or customers. It is really important to see how can we help them to address all the different concerns. The second topic is going to be actually how we can help you and how we can help the different clinicians. So the clinicians will be the person who are actually administrating the vaccine, whether they are nurses, doctors, helpers, or whoever, on how can they be effective and how are we going to track all the different actions. And finally, the last point is how can we make sure that we monitor through reports and dashboard the fact that everyone now is safe and can get back to work in a safe manner. So those are really the 3 angles and personas I'm going to be covering today. And of course, if you have any questions, again, feel free to jump in. So the first step really as part of getting the knowledge out to the population is to create a public portal where you can easily find information in terms of what are the articles, what is the process, what is the eligibility, what are the rules, who can get vaccinated, which are the vaccine, but also, you know, having a lot of articles and FAQ and help to answer common questions like what are the side effects, etc. So the idea is really, how can you provide a public portal page where you can inform all your citizens or patients or employees about what is the process, what are the guidelines, what are the recommendations, what are the side effects, what do you need to take into account to really make sure that everyone is aware about the next step that are going to come with a vaccination process. And I'll be sharing the slides later on, and if you see at the bottom, I already put some link of few of our live customers, so you can very easily just go there and have a look by yourself on how this portal could look like. And then it's really, as part of a self-service portal, is really to make sure that we provide a patient engagement solution where the patients or the employees got a few possibility to easily schedule, manage, and also book their appointment. So it's really about how do we make sure that I can register, I can reschedule, I can collect my relevant pre-vaccination information as well as privacy consent, like do you have specific side effect, do you have high blood pressure, are you pregnant, etc., etc. But also make sure that you communicate by notifying and reminding users about their upcoming appointment. And I'm going to be showing this process per email today, but it could also be an SMS or any other type of notification. And then we're also going to be covering how we can automatically also schedule the second dose as part of the different logistics that come with it as well. And finally, self-service is great, but especially for the younger generation, you also need to make sure that you can deploy a real-time chatbot where you can really automate repetitive requests. So the idea is really about what are the typical questions, how can we automate, but we are also going beyond that part on really how can you actually automate this entire appointment booking system, handle the eligibility, and also go to some pre-screening about the different personas that will be vaccinated. And again, I put a link here that we can easily have access to and play around with a live environment as well. So I will now go to a live demonstration, unless maybe Wiki, you want to jump in?
Yeah, maybe summarize a little bit for the attendees. Ya, jadi Bapak Ibu, kalau boleh saya rangkum sedikit, jadi di masa vaksinasi di Indonesia saat ini kan kita kan cukup berkejar-kejaran dengan waktu ya. Kita kan harus memberikan vaksin kepada pasien atau dari kantor juga kan pasti kita kan kejaran dengan waktu untuk memberikan vaksin. Nah, solusi dari ServiceNow ini memberikan solusi yang untuk simplified dari proses yang cukup kompleks ini ya, karena kan vaksinasi sendiri itu kan banyak menghubungkan pasien, otoritas yang memberikan vaksinasi, belum lagi kita harus berhubungan dengan rumah sakit atau tenaga medis yang harus memberikan vaksin, terus ada inventaris, penjadwalan vaksinasi yang ke-1 atau yang kedua. Nah, dari solusi ServiceNow ini simplified secara keseluruhan itu, gitu. Nah, kalau ada pertanyaan boleh langsung di open mic atau bisa tulis di kolom chat ya Bapak Ibu, nanti akan saya coba translate gitu. Nah, ini kita akan lanjut ke demo.
Thank you.
Okay, Olivier, please continue.
So what I'm showing here, and I'm playing a patient or a citizen called Julie Louis. So she is supposed to get vaccinated and she got access to a self-service portal. So that's the example of the self-service portal I was mentioning a little bit earlier. So as part of that, you can see that there is a very specific process about registration, entering your personal information, and then see how the vaccination gets scheduled. Yeah. You see, that's the demo effect. Okay, sorry about that. My session just expired. So as part of that, and this is responsive design, so it will be displaying depending on the size of your environment. So let me just. Okay, so as part of that, you can find a bunch of information about FAQ, frequently asked question. So I can give you just a few examples. You can open it there, and you can see all the different information about what is the program of COVID-19 going to be in Indonesia. You can find a bunch of information. You can also comment if you have some questions, or you can say, I don't know, this is great, and you can start interacting with your population that have also access to this portal, right? So you can find all the different information there, and it's very easy to actually update. You can just update the Word document and very easily just have as many information and knowledge article that you want. You can also have some specific announcement where you want to maybe launch some specific phase, like, oh, now we are opening the vaccination process for all the citizens older than 65 years, as an example. And you can really very easily go through all those different information. I was mentioning earlier that we also have a chatbot. So as part of that, you can go through a bunch of information, and it works in Bahasa, or you can change the different English, where you can very easily book appointment and also talk to a real life agent if you have some contact center. And if people don't want to go through all the knowledge article, they can also be put into a relationship with a contact center agent if need be. But as part of the process, I just really want to focus on the entire step. So the first one is, once you get access, so the idea is you can self-register yourself to this portal by filling information, email, first name, etc., and then you can get approved to that. Or we can also handle what we call mass booking. So as an example, if the government is launching this vaccination program for everyone older than 65 years old, we just need to upload that specific list. It could be employee, patients, or citizen into the system, and then the system will automatically trigger access and all the different credentials being sent to those different individuals, whether it is by SMS or by email, right? So I skip this registration link. Let's assume I'm here already, and then from there, you can go through some kind of a pre-screening situation where you can have a yes, no, and of course, you can schedule and you can customize all of those information. This is what I'm showing you here is really what comes out of the box, but if you want to have more information or maybe less, that's not a problem. You can also do it here. So let me just enter my address. And you can submit your vaccination. So as part of that now, the next step would be to actually select and schedule your vaccination. So as part of that, you will be able to select what is the site. So the site is pretty much the center or the hospital or the clinic that is going to administer that vaccination. So you can filter through state, city, or zip code, depending on what you entered earlier. And you can also just select a specific center. And most of the time, we will have the rules that we will only display the centers that are within 10 or 20 miles radius from your current location. So once you have selected the center and the site, you can go to some additional pre-screening questions that are more related to your health. Do you have any allergies or maybe some shortness of breath, high pressure, etc., etc.? Again, all of that can be completely customizable. So now the next step would be to provide some identification. And why is that? Because what we have noticed and realized from our different customers that are already using the system is, even though I am the one scheduling my vaccination process, someone else could actually go there pretending to be me and get vaccinated. So you need to put in place some kind of an identification process. So as part of that, you can define what is the form of identification document you want to have, whether it's a birth certificate, an ID, a passport, a social security card, or anything else. So I'm just going to go with that. You can select your birth certificate, and that's it. That's all the different steps that you need to do in order to get scheduled for vaccination. So once this is done, just give me a second. Yeah. So now you will see updates on that website. So the first one here is, what are your upcoming appointments? And you will see here that we have 2 different types of appointment. The first one for the first dose of Pfizer and the second one. So what is happening? As you may know, there are different types of vaccine currently on the market. Moderna, Pfizer, AstraZeneca, etc., etc. And each of those vaccine has different properties. So as an example, the Pfizer vaccine comes with 2 doses that need to be administered within 21 days. If I take the Moderna vaccine, the administration delay would be 28 days. So those are parameters that we are already putting in the system, and I'll show you later on how this is done, so that you will notice that the difference and the delay between those 2 appointments is exactly 21 days, because that's what needs to be done as part of the Pfizer vaccine. So once the appointment has been booked, and if I refresh, I should have gotten some email. You see, so automatically, I got already emails for the first dose, but as well as the second dose. And again, I'm showing you the email case, but it could very well be an SMS as an example. And as part of that email vaccination confirmation, I can find a few information, which would be the appointment start, what is the appointment code. I also have a QR code that can be scanned later on, and I'm going to show you how. You have what is the vaccination site, the address, and if you don't know how to go there, you can very easily go. We can integrate with any different map system, and you can really track the location as well. And you are also able to see the appointment. So you can print that page if you want, or you can just bring your phone, and you have all the different information here about what is the vaccine you will get, etc., etc. So now, what we showed you here was the system has automatically scheduled an appointment. And the reason is because we want to make sure that we maximize the capacity of the different centers. Because if you let you choose your own appointment, maybe there's going to be a lot of gaps, and the clinician will not be busy during the day because everyone will want to come early in the morning or late in the evening. So here, the system is automatically scheduling appointment based on a few criteria, and the main one being how many doses are available in that specific centers. And based on that, I will do my vaccination booking, and I'll come to that a little bit later on. So now let's assume this is my appointment, but I'm already busy. I have already planned, so I want to reschedule this appointment. So as part of that, I can cancel my appointment, but I can also reschedule it. So as part of the rescheduling, it's a very normal calendar view, so you can select the day. So let me just go on maybe on the 20th. And here, the system will be displaying what are the available slots for that specific center on that specific day. And this is really key, because each center may have different operating hours. Working from Monday to Friday, the hours may delay from 9 to 6. And you can also define what are the slots you want to define. Is it the interval of 15 minutes, 30 minutes, 1 hour, or 2 hours? So those are all parameters that come very easily configurable out of the box, and you can select what day. So now I'm going to say I'm going to change my appointment to be on Tuesday 20 at 10. And I will validate, and that's it. So now if I refresh my page here, you see now that my date has changed to be 20th of April, and automatically the system already booked a second booking within 21 days of my newly rescheduled appointment. And I'll go a little bit in detail about that a little bit later on. But that's pretty much the portal and the booking experience that we are providing to patients, citizens, or customers. Okay, is there any questions so far? Okay, then maybe I continue, and if you have more questions later on, you can come back. So now what we have seen was really how is the experience looking like from a customer / patient / citizen experience. So now the next point is, once as a customer now, I have my booking, I know where is the address of my center, I know when I need to go there, I know what are the documentation I need to bring. So now let's have a look on how it's actually going to look like from the professional's perspective, so the clinician or the nurse who will actually be administrating that vaccine. So for this view here, we will have a specific view for clinician and immunization partner that is available on web, but also on mobile devices. And I'll show you a little bit later on how this looks like on an iPad, where you can see all the different appointments that are scheduled for that specific date. You can have a different level of information about what should be the date, the dose, what is the state, who is coming, etc., etc. And you can also go into detail about how you actually manage that specific record, and more importantly, how you can manage no-shows as well as appointment cancellation. And I was touching a little bit upon that earlier, is from a center's perspective, you can define for each of the centers what should be the operating hours as well as the days and the slot. So that's really making sure that you can define specific hours and operating hours for each of the different centers. And those centers will also be taking account capacity. So that means that the system will automatically book all available slot based on capacity for that specific schedule. And one more thing here is, every time the customer is going to proceed to an appointment booking, the system will only show the available slots based also on allocated dose. And what I mean with allocated dose, let's assume a specific center has 60 doses available. So that means the system will take into account the inventory information and only be booking 60 appointments for that specific day, because there are not more vials and fuels available. So inventory stock is part of the automated appointment booking. And every time a booking is made, the system will also be booking a dose and be tracking once the dose has been used. And I'll show you that in a bit. And of course, we showed it earlier, as part of the email validation on SMS, you will get a QR code where you will be able to scan it once you arrive in the center. And I'll show you that in a second. So let me just change. Okay. Do you see my screen okay?
Yeah.
Okay, so this is my iPad, and you can see you can change the different view. It works as well on mobile devices, and this is really the tool that we're going to put available for the clinician. So you will see here the different upcoming appointments. So here I only have one, and remember when I was mentioning scanning a code or enter a code, you can define it here. The application already comes with a scanner. You can also define and enter a specific code here, or you can also see all the different appointments that are coming. So as part of our demo, remember, Julie Lewis is our customer and she just booked her appointment. So as part of that, the view of the clinician, you can go into filtering all the different appointments from a to date, and you can select. You can also define some specific filters if you just want to see all the different appointments that are assigned to that specific clinician. You can schedule by state. Is it canceled? Is it complete? Has it been scheduled already? And you can also define the view by only filtering by maybe the first dose and the second dose, and you can also define and searching an appointment. So usually what will happen is once the customer will come in the center, someone will be scanning the code, or you can just enter it from your email. And as part of that, you will be able to see the entire record of that specific person. And again, all of that is completely customizable. So if you want to have more or less information, that's not a problem here. So you will find information about Julie, her email address, her code. There will be, so Ellie Anderson is the clinician that is currently using that specific iPad that I have. You can have what is the program, what is the dose. So in this case, it's going to be the first dose for Pfizer, but again, it could be any other information. And you will see here on top something like ID verified. So remember, when I was scheduling my appointment as a customer, I have been asked to provide a form of appointment. And this is where I put, of identification. And this is where I put my birth certificate. So usually what will happen is you walk into the center, someone is going to scan your code, see all those different details, and probably the assistant is going to be verifying your ID, because you don't want the clinician to be spending time on verifying the ID. But again, this depends on the different cases. And then you have a few screening questions again. So you may ask yourself, why do I have to ask questions again? Well, because when I went to the portal as a customer and trying to book my appointment, I have been asked a few screening questions. So when the moment I filled that questionnaire was maybe 1, 2, or 3 weeks ago. So the moment I'm actually going in the center, you want to make sure that my condition hasn't changed. So this is why we'll be asking, and all those questions already populated with no were my answers to the previous question. So you can amend those. You can go into different questions. And you can also see here the interaction that you have with your customer. So as an example, if you are running late, you can say, I'm running late by 5 minutes, as an example. And you will be able to track the history and all the reschedule. So you see that here, I can also see my rescheduled appointment. So once this is done, you will actually go into administrating the vaccine. And as part of that, you will have here 3 main boxes. So let's say the administration has been done, the vaccine has been administered. You can mark that task as complete, meaning, okay, you have done the job, now we can go to the next patient. But you can also have the possibility to cancel your appointment if you need to. And there's also a no-show. So a no-show is pretty much if someone is scheduled to come to an appointment but didn't show up. So you can mark that person as a no-show, and what will happen in the backend is the system will then take this specific customer and proceed to a new scheduling. But we want to have those different types of scenario here for mainly analytic and reporting purposes. So in my scenario here, everything went fine. We have administered the vaccine to Julie, and we will mark the task as complete. Okay, and we got the confirmation that everything went fine. So now, if I go back to my appointment on my self-service portal, and I now refresh the page, you will see now that I'm only going to see one specific appointment, which is going to be the second dose. And you see, the system already takes into account that, okay, the first dose has been administered, it has been complete on that day, on that time. So now your next appointment is going to be on that specific date here. Again, If you're not available, you can go through the same process and you can manage a new appointment that will still be around plus minus 1 or 2 days from the 21 days that you need to have from the different doses, and the same process will go on again. So now that the vaccine has been done as completed, what is happening in the backend is also the system has in real time updated the inventory and had reduced that specific dose from the inventory to be registered as a used dose. And this comes with the serial number of the vial and as well as a bunch of information from the inventory that I will be showing you a little bit later on. Before I proceed to the last part, which is more going to be around reporting, dashboard, and back office, is there any questions so far?
Not yet in the
Okay.
chat.
Okay,
Okay,
perfect.
Olivia, let me summarize first ya.
Yeah, sure.
Summarize, halo Bapak Ibu. Jadi sesuai dengan penjelasan dari Olivier, tadi kita udah lihat beberapa tampilan ataupun demo ya dari solusi VAM ini, Vaksin Administration Management dari ServiceNow. Jadi kalau di tampilan pertama tadi kita bisa lihat untuk portal di mana user itu atau pasien itu datang registrasi ataupun login untuk melakukan janji temu vaksinasi, Pak. Jadi sesuai juga tadi penjelasan dari Olivier. Jadi kita juga tahu kalau vaksin itu ada beberapa tipe vaksin ya, Pfizer ataupun Moderna, di mana vaksin-vaksin ini untuk dosis keduanya itu punya range waktu yang berbeda. Contoh Pfizer itu kurang lebih sekitar 20 hari, tapi untuk yang Moderna informasinya sekitar 28 hari. Nah, itu semua kita bisa setting secara properti pengambilan second dose-nya atau vaksin yang kedua itu range waktunya berapa lama. Nanti ServiceNow udah bisa setting secara otomatis berdasarkan vaksinasi jadwal vaksinasi dari dosis yang pertama. Jadi itu gambar besar yang tampilan pertama. Tampilan kedua untuk clinician portalnya. Jadi ini untuk tim dokternya ataupun tim yang melakukan vaksinasinya. Jadi kita bisa lihat tadi kita bisa melakukan scan code baik melalui iPad ataupun mobile yang Bapak Ibu miliki. Kita scan code sesuai dengan kode scan yang diterima sama si pasien. Setelah pasiennya di-scan nanti akan muncul informasi jadwal vaksinasinya, informasi yang kuesioner yang sebelumnya sudah diinput sama pasien tersebut. Jadi bisa diverifikasi lagi sama tim yang melakukan vaksinasi sebelum vaksinasi tersebut dilakukan. Next, selanjutnya Olivier akan jelasin terkait dashboard ataupun kapabilitas report yang udah tersedia nih di ServiceNow terkait solusi Vaksin Administration Management ini. Jika misalkan ada pertanyaan, bisa raise hand ataupun melalui chat ataupun di open aja speakernya. Terima kasih Bapak Ibu. Ya, thanks Olivier, you can continue.
Okay, thank you so much, Pak Wiki. So now the next part is really going to be focusing on how do we track, how do we report, and a little bit as well of the backend configuration, because we noticed that we have a lot of IT people here in this call, so I'm happy to go a little bit more into the backend as well. So the first thing is really, how can you make sure that you track all these different last miles? Remember when I was talking about logistic, delivery, monitoring, administration, it's really important that you are also tracking all those different information in real time. So as part of our vaccine solution, we are also providing advanced analytics dashboards out of the box, and I will be showing those a little bit later on to really make sure that you have a real-time view and overview about what is happening in a specific center, but also at a much greater scale as well. So as part of the solution as well, because it is residing on our platform, we are also providing integration and communication capabilities where you can integrate this vaccine solution with any other external system, be it an EMR system. So EMR system stands for Electronic Medical Record System, as an example, or immunization, or government agency, or any other system that you may think is relevant in terms of sharing information or sending records of health-related information to of individuals. So we are also providing advanced integration capabilities if you want to integrate that system further. And then, as I was mentioning earlier, we are also providing supply chain and inventory capabilities. So what you see here is an example of a specific center. So that's our Burger Drive Auditorium Center that I used earlier. And you can see that for that center, you actually have around 1,170 available doses. So as part of that, the system is automatically dividing those doses based on the capacity. So this specific center can do around 60 appointments per day. So the system is automatically allocating all those 60 different doses, or 59 here, to every single day for that specific center until the doses are running out. And of course, we'll also be notifying about what are the changes as well. And this is really where it makes sense from an inventory perspective, because we're not only just tracking the doses once they have been used or been wasted, but every time a booking is happening, we are also already booking the doses, because we want to avoid a situation where you have employees or citizens having an appointment booked, showing up at the center, and then suddenly the center says, oh, sorry, we don't have any vaccines anymore. And I'm French, and this happens to my father like 3 weeks ago in France. So this is really a bad customer experience. So what you want to do is also providing a seamless customer experience to your patients or employees. So have the fact that on the booking will be based on inventory capacity for each center is also critical. And I was mentioning a little bit earlier, our vaccine administration management solution is part of our Now platform. So it's really, you will get and benefits of all the different capabilities from the platform, because we are all running on one single platform with one single data model. And as I was mentioning, can integrate with various systems, be it immunization, EMR, or any other additional system, but it also leverages all the different messaging communication channels that are available from our platform. And I know there was a question earlier about, oh, can we also do SMS? Absolutely, you can do SMS, but as well as different messaging if you want to and if you need to. But the idea is really, we provide you one out-of-the-box solution that will help you to provide a seamless vaccine administration solution to you, to your clinician, but as well as your customer or patient. So let me now go to the last part, and the last part of my demo for today, and it's going to be around showing you the backend system on how we can have a view on reporting, dashboard, but also a little bit more into the configuration of that system. Okay, so let me. So as part of the backend, as I was mentioning earlier, we have something that you would be calling the command center. So this is really an out-of-the-box dashboard and analytical platform where you will be able to find all the different information needed in terms of tracking and monitoring on what is happening. You have an overview view about what are all the different patient population being vaccinated, what is the amount of wastage. You can also track the different site teams, whether they are hospital, pharmacies, or clinics, but as well as tracking different types of sites individually, and you can also click on those links and have more details. But this is really more the overview, and we can really go deeper into the distribution itself as an example, where you can see how many vaccinated, what are the trends. We can have some specific shipped information about the different types of vaccines, whether it's Moderna, Pfizer, or actually something else. So you just upgrade the pie chart. You will see information about the shipping trends, the delivering on time. We can also move a little bit more into the administration itself. So how many patients actually have been scheduled versus how many have been administrated. And this is where really the analytics comes in. Remember when I was mentioning cancel appointment or maybe no show? So that's the part where you can track that, as well as what is the onboarding process looking like for all the different sites, how many providers are enrolled. And again, you can deep into all those numbers and have a better view, but as well as tracking what would be the side or the adverse effect after the vaccination. Is there some dizziness or something like that? So you can also really start tracking all those different information as well. And of course, you have an overview view, but you are also able to have a view for the different sites and centers and hospital individually. And all of those come out of the box. And of course, we have a drag and drop dashboards available. So if you want to pull more data or push data in there, it's very easily to add new tabs or new widgets of information that you may want to track. We can also track centers individually if we need to. So yeah, so let me go a little bit more into really the back end and showing how easy it is to actually configure. So the first thing is really going to define what is your program as part of COVID-19. Then for each of the program, you can define here what are all your different centers, clinics where you want to send people to get vaccinated. And it's very easily, you can just click on a new one and you can define all those different information about what is the center, the address, the zip code, and also what is the stock room. So stock room is really about the inventory, because you can track the inventory specifically. Then you can also define what should be the different vaccine models that you want to put available. And this is where you decide and define which vaccine are actually available for each of the centers. We can go into a little bit detail into the mass booking, but I was mentioning earlier about the knowledge article. Remember, those are all the different information that are available on the self-service portal for your customer or patients or employees, right? So as part of that, you can very easily add a new knowledge article. You can upload it from a Word document, and for each of those different articles, you can define the workflow, whether it is a draft. You can have some review or / approval process available as well, and you can publish it, and you can also retire them from the publication. So it's a very easy way on how you actually maintain all those different knowledge article, and the same goes as well for the customer. It's a very similar interface. And finally, what I want to talk about is more about how do you handle the different doses. So for a specific center and model, you will see that for that specific center here, you have all the different numbers of doses available. So here, 150,000, you can define what is the expiration and the availability of it. And then the system will automatically be allocating doses for specific days, and then make them also available here. So I think that was the day that I scheduled earlier when I had my second dose booking. So you see now that as part of, because I have an appointment, I have already one dose being booked and reserved for Julie Lewis here when she wants to get vaccinated. So that's just a very quick overview about how the backend looks like. You see, it's very straightforward. It's very easy, and this also brings a lot of flexibility and in terms of integration and implementation, because everything is out of the box and we are providing you the entire platform. We have seen customer going live within 1 or 2 weeks, and we will be happy to share more information about that as well. Okay, and Pak Wiki, you want to summarize this part?
Ya, sure. Jadi Bapak Ibu tadi sudah di-showin juga demo dari Olivier terkait bagaimana solusi ini juga udah di-provide ya kapabilitas reporting, dashboard, dan analitiknya tadi. Dan juga sudah di-show terkait inventory. Jadi kita di ServiceNow FAM ini juga support untuk inventory-nya daripada vaksin-vaksin tersebut yang sudah kita registrasi di platformnya. Tadi juga di-show juga ya terkait platform ServiceNow-nya juga. Jadi kita bisa lihat list record segala macam daripada vaksin administration management-nya. Jadi itu sih kurang lebih rangkuman dari Olivier terkait kapabilitas yang ada di ServiceNow. Please continue, Olivier. Thanks.
Yes. Thank you so much, Patrick. And then, as part of next step, we will be sharing after this webinar the slide as well as the video, as well as the link to the ServiceNow webpage, where you will be able to find more information on our vaccine management solution, as well as an out-of-the-box package that we can download in case you are already a ServiceNow customer and have an instance. And of course, we'll also be happy to discuss a bit more in details with each of you. What are your requirements? And if you found this session useful as part of next steps, we'll be sharing as well who are our contacts that you can easily reach out to. And of course, my team and myself are happy to go in deeper discussion in terms of more details about the solution. And if you want to understand a little bit more about some case studies as well as customer references that are currently using our solution. Terima kasih.
Okay, thank you, Olivier, for the presentation. Oke, Bapak Ibu, jika ada pertanyaan bisa menulis di kolom chat atau bisa open mic. Sementara itu mungkin saya coba summary sedikit dari awal sampai akhir ya. Jadi ini merupakan vaksin administration management merupakan solusi dari ServiceNow yang untuk merupakan solusi end-to-end untuk solusi vaksin ya. Untuk perusahaan Bapak Ibu. Nah, solusi ini sendiri tadi kita udah demokan ada 3, yaitu pertama itu dari sisi pasiennya atau yang akan divaksin, lalu yang kedua dari otoritas yang berwenang yang memberikan vaksin, atau misalkan dari tenaga medisnya, lalu yang terakhir itu ada dashboard untuk reportnya atau untuk mengatur semacam jenis-jenis vaksin, lalu alokasi dosisnya, lalu kayak seperti yang kita tahu kan setiap dosis itu kan jeda waktu antara dosis pertama dan dosis kedua itu kan berbeda setiap jenisnya. Nah itu semua bisa diatur di dashboard back-end-nya gitu. Lalu kita bisa juga untuk melakukan mass booking gitu. Nah, lalu mungkin sedikit gambaran di awal untuk dari sisi end user sendiri, ya yang pertama itu kan ada yang tadi di-show oleh Pak Olivier itu booking experience. Jadi ada suatu website portal juga yang bisa di-customize. Nah, lalu bisa juga ada salah satu fiturnya itu ya ada yang namanya fitur untuk memberikan announcement. Jadi misalkan untuk memberikan announcement yang cukup penting itu kita bisa umumkan juga. Lalu ada fitur chatbotnya juga, jadi untuk otomatisasi, misalkan untuk booking atau misalkan untuk jika ada pertanyaan-pertanyaan umum juga itu bisa melalui chatbot. Lalu di demo kedua itu untuk dari sisi otoritas yang berwenang itu ada scan QR juga untuk appointment confirmation, lalu bisa mengatur operating hour dan juga bisa mengalokasikan ketersediaan dosis gitu. Jadi kita bisa juga lihat berapa yang udah terpakai gitu. Nah, itu sedikit gambaran summary dari webinar hari ini. Nah, jika Bapak Ibu ada pertanyaan bisa langsung open mic atau bisa tulis di kolom chat, nanti akan saya coba translate ke bahasa Inggris ya. Itu mungkin sambil menunggu, saya akan ada beberapa pertanyaan yang cukup umum yang saya temuin. Olivier, I think I have a common question that could we have notification through SMS or even WhatsApp for I think maybe for the booking appointment or the cancellation?
Yeah, so what I have shown, remember, is when you proceed to a booking and maybe you reschedule it, there are reminders, everything. I have shown you that through an email channel, right? So now, if you want to have that through an SMS or any other like WhatsApp channel, this is possible and will require some integration with an SMS gateway or a connector to WhatsApp. But yeah, we can have various notification channels available. And you can also do paperwork if you really want to. And we have a customer in Europe because they started the phase 1 vaccination with the 80+ years old that don't have a smartphone, don't use laptops and all those smartphones. So for them, we actually send them papers with the details about the booking and the appointment. So yeah, we can have different ways of notifying people.
Okay. So not only the SMS or the WhatsApp notification, but we can send the paper also for the.
Yes.
Okay.
Yes.
Nah, ya, jadi Bapak Ibu untuk aplikasi dari ServiceNow ini juga bisa mengirimkan notifikasi melalui SMS atau WhatsApp dan juga bisa mengirimkan melalui hard copy. Jadi akan dikirim ke alamat pasien ya. Kira-kira begitu untuk notifikasi appointment-nya. Itu. Oke, kita masih nunggu jika ada pertanyaan. So okay, maybe Olivia, another I think the common question that could we also have a fully customizable for each company?
You mean the portal?
Yeah, the portal.
Absolutely. So what I showed you was the out-of-the-box service portal. But as part of that, you can define the logos, the colors, the interface, the text that you want. So everything is just very simple CSS and HTML through widgets. So you basically just drag and drop and customize the interface that you would like to have. Yes, absolutely. And you can have as many as you want. And in your example here, each company could actually have their own self-service portal. Absolutely.
Oke. Jadi buat Bapak Ibu nanti untuk aplikasi untuk ServiceNow Vaksin Administration Management ini nanti bisa di fully customize menyesuaikan dengan perusahaan Bapak Ibu ya. Jadi nanti ada satu portal itu nanti bisa menggunakan logo perusahaan Bapak Ibu sendiri, ya, terus juga atribut-atributnya bisa di-customize juga, mau itu pakai bahasa Indonesia atau pakai bahasa Inggris itu udah bisa di fully customize. Also regarding the language, could we do the vaccine administration management have the template for example, in Indonesian language, or do we have to customize by our own?
Okay, so all the buttons and all the action button, you know, like you click on your profile, all of that, we can translate it. We have language packs for Bahasa where you just translate from English to Bahasa. Okay. Now, obviously, if you are talking about a knowledge article that needs to be typed in, then this one you will have to type in Bahasa, obviously. But all the system interface can be translated into Bahasa. Yeah, we have language packs for that.
Okay. So have a language pack, right? Oke, kita masih nunggu pertanyaan atau misalkan ada yang... Oke, ada pertanyaan dari Pak Hardi Agung ya. Bisa diintegrasikan. Oke. Olivier, we have a question from Pak Hardi Agung. Do this vaccine administration management could be integrated to their own database? Their database.
Yes. So what we are seeing and what we have done with previous customer, right? So let's say you are a company and you want to offer this portal to your employees, right? So what you can do is we can integrate with your employee base and just automatically schedule mass booking. Or you can just provide me asynchronous files about, okay, as a phase one, I want to have all the maybe 50 plus employees. So you're just giving me and you're pushing me this list of 50 plus employees as an example, because we can integrate with a database, no problem, right? But then you need to think about all the different compliance. Those are maybe some critical or PII data. Maybe you have some health data, etc., that you may not want to expose as such. But we can definitely integrate for sure.
Oke. Jadi Pak Hardi bisa diintegrasiin Pak ke existing database-nya. Terus juga bisa untuk mass booking ya Pak. Jadi bookingnya itu secara langsung banyak pasien ya. Also regarding the mass booking, do we also doing the mass registration? If we don't, if the company doesn't have the, the database of the patient. I mean, okay. If the employee also want to register their family.
Yes. Okay. So you can. There is a self-registration link as well, where you can just go to the portal and just register yourself, right? And you can register for you and your family, and then someone will approve that, and then we'll go into the have access to the self-service portal. So the company can decide to automatically register their employees and their families if they have the data, and we don't need much data, right? Like first name, last name, and email as a minimum. But if you want to send SMS, then obviously the SMS number would be needed here. Or you can just let everyone know, please go to that specific URL and register yourself. So those are the two different models that we support.
Okay. Also, could we register the other family member on behalf of our parents to register?
Yes, so for that you will be able to use the register link,
Okay.
and you will just self-registering for whoever. Yeah.
Oke. Iya, Pak Adi, mungkin ada informasi tambahan juga, jadi selain bisa koneksi ke database yang existing, juga bisa mass booking, atau juga bisa mass registration ya Pak. Itu oke. Kita masih open mungkin sampai 11.15 ya. Saya masih nunggu pertanyaan. Jika ada yang mau ditanyakan boleh menggunakan bahasa Indonesia juga nggak apa-apa. Nanti saya coba translate. Bisa di open mic atau bisa tulis di kolom chat. Saya sambil mengingatkan juga jangan lupa untuk mengisi survei yang ada di kolom chat. Nah, nanti ada certificate of attendees ya. Oke, mungkin belum ada pertanyaan lagi. Mungkin saya thank you, Olivier. I think we don't have any question anymore. Thank you for your time and thank you for the presentation.
Sure. So, and again, if you do have questions later on, feel free to reach out, and we'll be sharing some key contacts where you can reach out to, and we are happy to answer any question or do some additional deep dive demos. No problem at all.
Okay, thank you so much, Olivier. Thank you so much for the service now team. Terima kasih Bapak Ibu buat kehadiran di webinar hari ini. Jangan lupa juga untuk mengisi link survei yang ada di kolom chat. Jika masih ada pertanyaan nanti bisa hubungi saya atau juga bisa menghubungi tim Customer Experience. Terima kasih buat kehadirannya untuk di webinar hari ini. Selamat siang.
Terima kasih.
Remember when I told you no matter where I go, I'll never leave your side, you will never be alone. Even when we go through changes, even when we're wrong, remember that I told you I'll find my way back home. I could never let you go, couldn't run away if I tried. 'Cause even when I'm all alone, you got a hold of my mind. And I'll always let you know that I'm always gonna hold on. And I told you right from the start, you just say the word and I go. No, it doesn't matter how far, 'cause your love is all that I know. Baby, you just stay where you are, and you know I won't be too long. Hold on. Remember when I told you no matter where I go, I'll never leave your side, you will never be alone. Even when we go through changes, even when we're old, remember that I told you I'll find my way back home. 기억을 걸어들어 멈춰진 시간 위에서 선명히 너는 떠올라 길 잃은 맘속에 널 가둔 채 살아 그만 멈춘 시간 속 잠든 너를 찾아가 아무리 막아도 결국 너의 곁인 걸 결국엔 여행을 끝내 이젠 돌아가 너라는 집으로 지금 다시 way back home 세상을 뒤집어 찾으려 해 오직 너로 완결된 이야기를 No, I won't ever lose as long as you're there. 빛이 다 꺼진 여기 나를 안아줘 눈을 감으면 소리 없이 밀려와 이 마음 그 위로 넌 또 한겹 쌓여가 Even when we go through changes Even when we're old Remember that I told you I found my way back home